Okay, there's a few people still wandering in from breakfast, but we're going to get started since we're on the web and others around the country expecting this to get going on time, so we will. My name's Dave Kindig from the University of Wisconsin School of Medicine and Public Health, and as co-chair of the IOM Roundtable on Population Health Improvement, I'd like to welcome everyone to today's workshop, our guests, and particularly our distinguished speakers and panelists who've agreed to join us. Let everyone know that this whole meeting is being recorded and webcast, so we'll be live and online, and that whole webcast will be available for anyone shortly after the meeting. And we welcome people that we know are joining us on the web, including, I understand, a whole group at the Mayo Clinic. We will take questions and comments from the virtual audience through the web, and we will try to get to answers to them as time permits during the day. So this roundtable provides a trusted venue for leaders from the public and private sectors to meet and discuss the leverage points and opportunities arising from changes in the social and political environment for achieving better population health. The Roundtable's vision is of a strong, healthful, and productive society which cultivates human capital and equal opportunity. This vision rests on the recognition that outcomes we seek, such as improved life expectancy, improved quality of life, and health for all, are shaped by the interdependent social, economic, behavioral, and healthcare factors, and that moving those factors will require robust national and community-based policies and dependable resources to achieve it. That's what our work is about. That's what all these workshops have been about. That's what today is about. That's what our ongoing work in the coming years are about. Strong policies, robust policies, and dependable resources underline that, right? As one of its major activities, our roundtable sponsors workshops like this for members, for stakeholders, and for the public to discuss issues of importance for improving our nation's health. Today's workshop will feature presentations and discussions on the role and potential of the private sector in improving economic well-being and community outcomes in the role that they play as major determinants of health. You will note that the workshop title begins with the phrase, Applying a Health Lens, Roman numeral II. Roman numeral I, Applying a Health Lens, was a workshop a year ago that primarily focused on public sector health in all policy approaches in sectors like housing and transportation and others. But the population health improvement challenge is so great that we're going to need all hands on deck engaged together to reach these goals. So it is appropriate and timely that we focus today on what the private and business sector is doing and can make even greater contributions going forward to the population health. So that's all I have to say by way of introduction. If there are any logistics questions as the day moves on, we have staff in the back and at the registration table wearing green name tags. The meeting materials include items given to staff in advance, and other materials that come during the day will be posted after the workshop. So each of these workshops is guided by a planning committee of roundtable members and others, and that's why we get the quality products that we do. This is a group activity. And I'd now like to introduce Ray Baxter, who chaired the planning committee for this workshop. He's Senior Vice President for Community Benefit Research and Health Policy at Kaiser Permanente and chaired our planning committee. Ray, thanks for doing that, and over to you.